There's a difference between managing a system and being responsible for the outcomes it produces. My guest today operates in that difference. Dr. Sameer Kulkarni has spent nearly 2 decades inside one of the most complex, high stakes industries in the world, healthcare. Not observing it, not advising it, running it. From leading operations and strategy across institutions like Fortis Healthcare and Apollo Hospitals to taking full P&L ownership of 5 multi-speciality hospitals at Paras Healthcare, managing 1,400 plus beds and 800 plus crore in revenue, he understands scale, pressure, and consequence. And a quick personal note, one common thread between us is Case Western Reserve University. We both went there for our MBAs, which makes this conversation even more special for me. Today, as a CEO of Dr. L.H. Hiranandani Hospital, he's not just running a hospital, he's shaping what modern healthcare delivery looks like, expanding infrastructure, driving patient outcomes, balancing empathy with efficiency, and doing it in an environment where every decision actually matters. But this conversation isn't just about healthcare, it's about decision making under pressure, psychology of responsibility, and what it really takes to lead when the stakes are human. So, Dr. Sameer Kulkarni, welcome to this show. I'm just so excited to record it with you.
Thanks. Same here. I'm looking forward to it.
All right, now before we get into the scale and leadership you operate at today, I want to start a little earlier because I'm always curious about how that way of thinking actually gets built. Now, you started as a doctor and today you're running institutions. When did your identity shift from being a clinician to a decision maker?
I'm basically Dr. Samir Kulkarni. I did my MBBS from BJ Medical College, Pune. And after my MBBS, that is my MD, medical doctor, I went to, I was practiced in Barshi. It is in Solapur district. So I used to cover around 21 villages over there
Oh, wow.
and used to take care of around 21,000 patients. What used to happen? I did it for almost 1 year. What used to happen was I used to advise investigations, I used to advise medicines, but affordability was an issue. So patients were not getting investigated, patients were not taking treatment. So my effectiveness was very less. So at that point in time, after 1 year, I felt that I'm not effective at all. So that's the moment when I decided that I will shift to management and try to address this issue as a system, not as a individual doctor.
So tell us, what does responsibility feel like at your level today? Because responsibility at scale isn't just work; it's a different ballgame altogether. How is it your day to day, and what is the level of responsibility we're talking about here?
So responsibility actually here feels like a blessing because it is an opportunity to make a difference. So you can design policies, you can discuss like what actually decide what kind of talent you want to hire, what kind of value proposition you want to give. So it's a tremendous opportunity. So more than responsibility, I feel it is a blessing and it's an opportunity to do something which is worthwhile.
Now, what's one decision early in your career that shaped how you lead today?
I think that's clearly MBA from Case Western Reserve University because, as I said, when I decided to move from individual doctor to system maker, then what happened that I gave exams for that career counselor and something like that, like the coaching classes. And I was not in touch with maths for almost 6 years during my medicine period. So I failed in that exam, and they said that you won't be able to do MBA from even top 50 schools in India. Forget about doing it from abroad. But somehow I worked on GMAT and then I gave GMAT. I got 690 score, which is not very good, but not very bad either from medicine point of view. And then I went to Case Western Reserve University, and that was a life-changing event for me. As in case, we worked with people from students from different continents like Europe, US, China, Japan, Middle East, Africa. Everyone had a different kind of thought process. Most important thing that I learned from case was appreciative inquiry. So it is always easy to build on strength rather than focusing on weaknesses. So that was one thing that I still use in my day-to-day working. Second was design thinking, which was very unique with case. So you see it as a design and you design it and you design a system and then address the issue. Don't address the issue in isolation. You create a whole system around it and solve it. Another thing that helps me is Spirit of Intent by Sam Thomas. So I don't know whether Sam Thomas professor was with you or not, but he was with us and it was Spirit of Intent. So whatever you are doing, try to be respectful towards the spirit of intent. Never do anything which is disrespectful for spirit of intent. Another good thing that we learned at case was doing well by doing good. So that was also one of the things that I learned from case. The most important thing was diversity. So when we started the class, we were given lectures on diversity. Like my opinion can be totally different from your opinion. Both of us can be right, and both of us have to be respectful towards each other. So that diversity learning was imbibed during case period. So it actually made me more confident. And one thing I remember during case that I was attending one class, and one entrepreneur from Cleveland attended the class in an executive MBA program. So he gave me some maths calculation, and I did it in 30 seconds and he was not ready to accept that it can be done verbally. So he wrote it on the paper and he took around 4 minutes and he came to the same answer that I came to. And then he said me a wonderful thing. He said that people tell me that you should hire people from India
Yeah.
who are very good at maths. So I'm going to do that now. I'm going to hire. So he did not say that I will learn this thing. He said I will hire a resource. So that thing stuck to me. And then onwards, what I do is I always hire people who are better than me in their
Mhm.
respective functions. Like in HR, I would hire a person who is better than me in HR. In marketing, I will hire a person who is better than me in marketing. So that actually helped me kind of in my day-to-day working.
I love
So
how
a lot of
you
learning from case, and that actually made a huge difference.
actually, I can see that. I mean, I think I probably would have had a different segment to talk about case western, but you've clearly covered everything that you've learned and also very nicely. And you know what? My next topic was into data and numbers, and you've nicely ended with that math segment. So let me bring you to my next question, which is, do you rely more on data or instinct? I'm curious because how you structured your thinking is, do you approach problems like case studies? How do you look at them?
Data or anything. So in early part of career, it was more of a data
Okay.
because what used to happen that in early part of career you are really risk averse. So you don't want to take any risk. If something fails, then you always have a data to blame. So that is in early part of career. But at this stage of career, you can't just rely on data and then take some decision if it goes fail, and you can't say that it is because of data. So instinct is very important now. So of course you will not take any blind decision, but
Hmm.
instinct takes priority over data. Data might say something else, but your instinct and your experience and what you feel, that is more important. And finally, you are responsible for the result. So
Yeah.
either way, it is better that you go by data as well as instinct.
Okay, so tell me, understanding on where you give the weightage on data as well as instinct, if you had to break it down, how do you approach a complex problem today?
Okay. So in terms of approaching a problem, uh, what we see is what is the impact that that problem is having.
Yeah.
Whether it is impacting patient, whether it is impacting organization, whether it is impacting my team, or whether it is impacting me.
Okay.
So first, that thing is important. And once that is decided, then we come up with different solutions. And in that solution, we will always choose a solution which will solve a problem for patient. Because if you solve a problem for patient, you will solve a problem for organization, team, as well as for me as well.
Perfect.
So patient becomes a priority. Whatever solution is more consistent with the patient, then we will do that.
All right. Okay. Moving on, tell us what kind of pressure sharpens you and what kind of pressure drains you, because the way you respond to pressure says a lot about how you lead. So, where does your focus go?
So pressure that kind of helps me is some new programs, scaling up things, starting something new. So those
Okay.
kind of things, those are pressures. New, we start some new clinical program. So that kind of pressure helps me, and I deliver better results in that. Pressure that drains me is that is actually my personal weakness as well. I like doing things.
Hmm.
I don't like showing things. Like I feel that my work should speak for itself. and I don't have to say anything about it. So when
Hmm.
there is a pressure that you do a good job and then you have to promote that I have done a good job, I have done this, I have done that.
Yeah.
So marketing part of it is slightly like I'm not very comfortable with. It is my weakness. Uh, I, I was always a topper, so I never had the need for validation or anything like that.
You didn't have to
So
show it.
yeah, so
You were
that's
repeated.
something pressurizes me. So what I do is I generally hire a person. Marketing head is always better than me in marketing. So I make sure that you do the work. I will do the doing.
Yeah.
You work on the showing. Showing part is taken care of them. But right, like I have got a very good mentors like who have helped me get through on my weakness. So
Hmm.
last 10 years I'm working on it. If you see my LinkedIn post nowadays, I do a lot of postings on LinkedIn. I'm
Yeah.
not comfortable doing that, but still I do it to basically overcome my weakness.
Yeah, no, do you feel like these days they say that even though you're an accomplisher, but you need to still put it out? So it's also all a part of personal branding also. So kudos to the people who've been managing marketing for you because they're doing a commendable job. Each and every feed is getting filled up with good news. And
No,
with
that I'm doing personally.
oh, that you do personally. Okay, so I'm going to give the entire credit to you then. So good that it's shaping up, and also the consistency is also good. So I think even though one is a stellar performer, but unless you show it to the world, that makes a lot of difference, especially in today's day and age. All right, now I'm going to take you to another segment, which is about running healthcare at scale. So the question is, what do most people misunderstand about running hospitals? Because from the outside, it looks structured, but I'm sure the reality is far more unpredictable.
Yeah, so general perception is that it is very easy to run a hospital. It is just like any other business.
Yeah.
And with a lot of private equity coming in, they feel that parameters are more or less same. But it's
Hmm.
not like that. It's a very complex structure, and everything happens live, and there it is irreversible, and it's always life and death situation. So stakes are very high. Another thing that people have is people feel that aim of hospital is to earn money. So
Hmm.
that is not in truth in entirety. Aim of hospital is to treat patients. So everyone is focused on patients, and money is a byproduct of it. Of course, money is important because otherwise we won't be able to run the hospital. But main aim of the hospital, core aim is to treat patients.
All right, beautifully answered. Tell us when you were managing five hospitals, what was the hardest part? Was it people, was it processes, or unpredictability? I have given
Mm,
a lot of time and effort to writing down the questions. So I was like, let me see what he's going to answer.
I think it is more to do with people
People.
because these five hospitals were located in five different geographies. So each hospital had its own culture, the way they work. Processes you can say standardized because a lot of IT automation happens. So through IT you can design a process and then it has to be implemented. Otherwise the system will not run. So processes is taken care of. Unpredictability, we can define escalation matrix and solve it. That if this happens, then it will be handled by this particular team. So all those things can be handled. But the people aspect, we need to work very hard. You need to identify right talent and train them well. They have to be aligned with the patients, with the organization. So all those things are very important.
All
So
right.
people is more important.
Okay. Now, we also feel that at every level, every decision has a trade off. How do you balance clinical excellence versus business sustainability?
So we had a course on sustainability, but it's not during MBA. I think clinical excellence is prerequisite for business sustainability. So clinical excellence, if you don't do that, then in long run your business is not sustainable. So clinical excellence is not negotiable. You have to focus on it. You have to deal with it, and it's a kind of input. And business sustainability is the output. So there is no trade-off. You have to do clinical excellence in order to achieve business sustainability.
All right. Now, I'm going to ask you a question which is slightly different, which is, in your opinion, what do you think? Is healthcare ultimately a service or a system?
Of course, system because I used to do it as a service, and as a service it I failed, and as a system I'm fairly successful. So I feel that it is a system because there are so many people who are involved. Like 2,000 employees are working over here. So
Yeah.
many vendors are there, 250 doctors are working. So it's huge system which kind of delivers healthcare.
Hmm. So we've understood a lot of theoretical concepts from you by far in the discussion. Let me make this a little practical. If I gave you a failing hospital today, what are the three variables you would analyze?
Failing us, first thing most important is patient feedback.
Okay.
So what are patients talking about the hospital? What is their feedback? That is what first variable that is most important. Second is quality of medical and non-medical talent. So what kind of talent is available over there? And third is what is the infrastructure and technology. So these three parameters are most important.
Um, we've spoken about scale, we've spoken about people, processes. Tell me, does it ever feel like isolating at the top?
No, no, it's not like that. I mean, we basically work with like there are 250 doctors, and these are cream of the society. So you
Hmm.
work with people who are having very high IQ. So it's intellectually kind of challenging. It is emotionally satisfying, and it is financially rewarding. So you never feel alone. I mean, it's amazing. It's awesome. And then patients also come to you. They meet you. They share their stories. Many of them are happy. Many of them are sad. So it's all live things. So it's you never feel alone. I mean, it's all lively.
All right, amazing. Now you worked across systems at scale, but stepping into a legacy institution and choosing to transform it, it's a very different challenge. So let me ask you, what was your first 90-day strategy as a CEO? Because those early decisions usually define everything that follows. So what was on top of your head when you just started?
So when I started, my focus was more on listening. So
Okay.
first 90 days, it was all about listening, 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 and understanding what patients want. So we went through all patient complaints. We met each and every doctor. We took feedback from there. Then we met all employees, visited all areas of hospital, talked with everyone, took a pulse of the hospital. So promoter had a vision. I had a vision. So what is the ground reality? Where is the gap? I mean, where is
Yeah.
it currently existing, and then where we want to take it and how we will take it. So for that, first thing most important is to understand where the system currently is. So that was the first 90-day strategy, is to understand and listen. So I'm listening kind of mode, and I'm understanding.
All right. Okay. Talking about listening, which mean you were spending time with people. Now, I want to know, how do you decide during those 90 days? How did you decide what to prioritize on? Basically, talking about infrastructure, people, or technology. Now, strategy might sound good on paper, but execution is where things get real. So, where was the initial focus after listening to how the systems were being played by that time?
So at that time, first point was patient feedback. So whatever was affecting patient, we saw whether it can be solved through technology, through infrastructure, through processes. So technology infrastructure will take some time. Processes management, training management, all those things can be done immediately. So we focused on low hanging fruits and we worked on them first. And then we upgraded technology. We brought in a new HIS, new hospital information system. We started a patient app. Almost 25,000 plus patients have downloaded the app. So all those things were done in due process.
Okay, all right. Now there's this concept of excellence, right? We spoke about, what does excellence in healthcare actually mean operationally? And I wanted to pause on that because that's not easy to get right at scale. What will you say?
So in terms of excellence in healthcare, what we can like what I have kind of come to the conclusion that whatever is been advised at the time of admission or at the time of consultation versus the actual outcome. So some outcome is kind of communicated to the patient that we will do this particular intervention and this will be the outcome. So how consistent are you with that outcome is most important from clinical point of view, and from financial operationally financial point of view, we give estimate to the patient that your bill will come to this level, and it should be less than 5% plus minus from that amount, that figure. So
Okay,
if it is less than 5%, then it is we are able to achieve the financial excellence as well as operational excellence and clinical excellence. So
all
it's
right.
it's made simple kind of.
Okay. Now, during our research, we got to know that you reduce nursing attrition significantly. How did you approach that?
So I happened to attend one educational program at NUS, Singapore.
Hmm.
So when I talked with my nursing head, they said that nurses from our hospital are going to Singapore, and that's the reason there is high attrition, and they are getting good job there. So I attended that course, and there I was told that nursing attrition is a big issue in Singapore,
Hmm.
and nurses from Singapore are going to London and US. So
Hmm.
I understood it is a universal issue. We thought we blamed Singapore, but that is not the case.
Okay.
So then we said that what we can do in within our capacity in our organization. So that was the first thing. So we identified the problems. Roti kapda makan.
Hmm.
So they want a good nursing hostel. Mumbai is very humid, so we started with AC hostel for
Okay.
them. Their laundry and clothing was taken care of. Their food, we started food allowance for them. Then we increased their salaries. What used to happen that we used to hire nurses in bulk, and
Hmm.
then the pressure for performance was tremendous, and they were not able to perform properly, and then they used to leave the moment they get an opportunity. So we increased salaries, we increased works, and we changed the hiring criteria. So written test was there. We changed the passing marks. So only we hired quality talent.
Okay.
So this quality talent came to us. Then we adjusted the nursing ratios. So one nurse can see so many patients. So there are industry standard ratios. We
Okay.
beat those ratios. We had a better ratios than the industry, and so workload was also less. We treated them well. We treated them like family. We took care of everything. And this nursing attrition suddenly in 2 years reduced from 75% to now it is 21%.
Oh,
So
wow, that's
yeah,
remarkable.
yeah. So no one leaves us. That is very good.
I mean, this would have also involved a lot of investment, talking about all the infrastructure, like their dorms and making sure they're paid well and everything. Like, there
Yes.
would have been a lot of process which would have gone to bring things to a number which is like 21 or 20, right? 20 is
Yeah,
your.
but so in terms of financial outcome, operational outcome was that we used to get around 15 to 20 nursing complaints every day. That
Okay.
reduced to around 0 to 2 complaints every day. So
Okay.
that kind of patient satisfaction we were able to achieve. Clinical excellence we were able to achieve, and our average length of stay reduced. So it helped us financially as well.
Commendable. All right. So, alongside people, technology is becoming central. How do you think about tech in healthcare? Do you think it's an enabler or a differentiator?
I think both, because differentiator definitely people are looking for technology, and they feel that technology is something which is must. It is part and parcel of daily life. So we have launched patient app. We have done lot of yeah, we have done electronic medical records. So your records are accessible all across the world. So all
Oh.
patients can see the records electronically. We have added 5G ambulance, which is a kind of 5G technology ambulance where everything is feed is live. So when this ambulance goes to the patient's home, it is kind of ICU going to that patient's home. So
Hmm.
patient is picked up, and moment he is picked up, immediately treatment starts. So we don't waste time in transportation. In Mumbai, there is a lot of traffic, so sometimes it might get delayed. So that
Hmm.
treatment starts immediately, and there is audio video kind of connection through which super specialist doctors decide what kind of treatment is to be given to the patient. So in general ambulance, there is a doctor, but that doctor is not super specialist. So he cannot decide what to do. But if in our case, super specialist is available, he decides the treatment then and there itself, and treatment starts moment patient is picked up from the home, from his home. So that is kind of amazing, and it has saved multiple lives. So technology has a huge role to play, and it is a differentiator in life of that particular patient.
Yeah, beautifully answered. Now, slightly different tangent. When you're making decisions across people, systems, and technology, you're constantly operating under pressure. So, I want to know, how do you make decisions when there is no clear right answer? Because that's where leadership really shows up, right?
So, what I do is I have a lot of CEO friends. So, first of all, I decide whether the issue is strategic of very high importance or it is a normal thing. If it is a normal thing, then I take a call. This is my input or my kind of thought process. But if it is a complex problem, high level problem, so what we generally feel that my problem is unique, I am in a unique position, no one is facing this problem. That is not true most of the time. So I talk with five different CEOs and ask them. I don't give the exact details, but I give them the context of the problem. And in my experience, most of the time they have faced that situation. So they tell me that I faced similar situation. I did this and it did not work out. This worked out. So I get five perspectives from five different CEOs. Then I talk with my team. So my
Okay.
team gives me another perspective. These are six perspectives that I get.
Yeah.
And this is these perspectives. Then I use that framework, what is right for patient, what is right for organization, what is right for my team, what is right for me. And combining these two frameworks, I take a decision. And then I convey my decision to my boss because it is of strategic importance.
Hmm.
Generally, I don't delegate my decisions upwards. So I take a decision and I tell my boss that this is what I feel, this is the issue, and this is the way I am approaching. 90% of the time, boss says, okay, do it. 10% of the time, he or she has a veto power. So they tell that, no, you do this instead of this. Then I do that and
Yeah.
we execute it and when we get the results.
I mean, honestly, Dr. Samir, I was thinking you're probably going to give me like a this kind of an answer, but the fact that you took me through the entire framework, five CEO friends, and then one team decision, and then six collated together.
No, I forgot one thing. I also take input from some person outside industry, like
Okay.
out not from healthcare industry. So I
Mhm.
will talk with you or anyone from finance industry, IT industry, because
Mhm.
they have no idea about the complexity of my environment. So
So
they
they'll
give
have
me a
it.
very fresh perspective.
Got it.
They will give me some example from their industry and how they deal with it. So that also gives you another perspective. So I combine that as well.
So seven of them together now.
Yeah.
Okay, amazing. Um, all right. Let me ask you, think it over nicely. Have you ever made a call that kept you up at night? And what goes through your mind during those moments?
There are multiple such things I have
I
done.
was thinking, I said I should not even be asking, have you ever, like, there is definitely not going to be one, there are going to be multiple instances, but what is it that comes to your mind at the top right now? Just for an example.
Many things happen, like patient comes to your hospital and then sometimes there is some accident or something and then you have to decide whether you have to go with treatment or not and there is no relative available. So there are multiple scenarios like that in which doctors take call and then they ask you for permission to do that. And
Hmm.
then you say yes by taking that risk in order to save that patient's life.
Yeah.
And then you're not very sure of the outcome. If it goes well, if it happens everything well, then there is no issue. But if it doesn't go well, then relatives might say that why did you take that call? Why did you
Hmm.
not inform us? So lot many things can go wrong in healthcare.
Yeah.
Even with your good intent and your good efforts, results can be totally different. So till the time that outcome is positive, you kind of you can't sleep. And then,
Yeah.
and in the night you get a call that everything went well, everything was smooth, and then you can relax and be happy about it that you saved someone's life. But till that time, kind of you are under tremendous stress.
Yeah. All right, tell us, do you believe leaders should be emotionally detached to make better decisions?
No, no, I
Right?
think no, no. I think a leader has to be emotionally attached at least in my industry because these are all human beings, and as I said, it is irreversible. If you take a wrong decision this moment, and there will be outcomes which are kind of patient either will die or will have a morbidity, and patient will stay with that morbidity for lifelong. So you have to be emotional. You have to be kind of have empathy. You have to understand what patient is feeling. You have to counsel patient. You have to guide patient what should be done.
let me
So
let me
as
ask you let me ask you this way, that if the way that you're mentioning, being empathetic and having that perspective, trying to understand the patient, all of that is required, but if you become invested in a patient because you get attached, it also kind of, you're not able to decide, or you probably might just get into a bias, right? Because there's a lot of favorability thinking from a patient's perspective. How do you take like a balanced decision then?
decision is always taken by patient. We just have to tell him what is best for him in your view,
Yeah.
and give both sides both options, and then let the patient decide. So there you have to be kind of very practical and scientific rather than
Yeah.
emotional. So you shouldn't mix science with emotions. Emotionally, I'm attached with you, but medical science says this, that if you do this, then this is the risk. If you do this, this is the risk, and this is the benefit. So you take a call. So many of the time they said, "What will you do?"
Mm.
So in that case, you can't share that. I mean, you have to tell them that no, sir, it is your call. You have to take it. You discuss it with your family members. You discuss with anyone who is unbiased,
Yeah.
because I don't want my opinion to make have any bias for you.
Mm. Okay. Tell us, if we turned your role into a case study, what would be the central dilemma?
So my role is now expansion, expanding the hospitals. So we are into expansion mode. So main problem is whether when the scale is important or the quality is important. So in India, accessibility is a big issue. So scaling the program, scaling hospitals, that is more important, or having the quality on day one is important. So
Hmm.
that's something which is central to the role. So when like we started a heart transplant program, so we hired heart transplant team, we purchased all the equipments, we hired all staff, technicians, nurses, we trained them, we designed all clinical protocols. So we did lot many things. But quality was not achieved on day one. It took us 6 months, and then we did heart transplant, and it was successful. So
Hmm.
first you have to achieve scale. First you have to add new programs, and then you have to build quality. So that and patients are real. So I mean,
Yeah.
it's kind of very important. It's not that you can just say that I failed. It's not that easy. So you can't fail. That is not an option.
Yeah.
Not fail in terms of your inputs.
Yeah. Extension of what you've just explained, let me ask, what does accountability feel like when the outcomes are human? I think you've already given me an answer to it, but just an answer to this question, how would you address it?
It's a huge responsibility because human life is at stake. So you can't just go wrong,
Yeah.
and it's kind of tremendous responsibility. In terms of input, you should not do anything wrong, because anything you do wrong, it
Yeah.
will hurt your conscience. So
You have to
you
be
have to
very.
be very open about your communication, that this is what we have, this is what we don't have, and
Yeah.
you have to tell the pros and cons, both things. If you don't tell the cons, and if something of that thing happens,
Yeah.
then you feel guilty about it. So communication is very important. So
Very
in
important.
terms of accountability, whatever is there, we have to communicate transparently to the patient. So that is most important.
All right, perfect. Now, because over time, decisions don't just shape outcomes, they shape who you become as a leader. Question is, do you still feel like a doctor, or has that identity evolved completely now that you're in the CEO position?
No, I do feel like a doctor because we are treating patients. So it definitely, I do feel like a doctor.
I was expecting a humble answer. This is 10% what I was thinking. All right, tell me, what part of your identity did you have to let go to become a CEO? Because leadership isn't just about knowledge, it's definitely about presence. So, what is it that you had to let go of?
Mm, one thing I think is like when we were in school, I used to be topper. So even during MBA, there were 21 subjects, and I had top score in all 21 subjects. I got straight A's. My GPA was 4.0 by 4.0.
Hmm.
So in school, in colleges, variables were very less. So
Hmm.
now variables are too much. I mean, there are 200 plus parameters where you have to monitor. So this urge to be best in everything, and I have to top in everything. I have to achieve top score in everything. That I had to leave when I became CEO. So again, as I said, I got very good mentors
Yeah.
who taught me how to do it. So we use Pareto principle. Like you have to identify only 20% of the tasks which are most important. So in
To
80% of the tasks, you have to let go. I mean, you should be only competitive in those tasks, but in these 20 tasks, you have to be outstanding. So letting go in those 80 skill pains, that you are only mediocre, or you are just being competent for that particular task, but you have to be okay with it. So that thing is kind of it's difficult.
Okay. All right. Tell us, how do you command authority in room full of experts? I mean, you've been an expert yourself, but when you are in a room, you're having a discussion, or there could be any meeting, and there are so many, like you said, uh, super smart, intellectually strong people in the room. How do you command authority then?
So I feel that I should not be in a position to command authority. It
Okay.
is more of a kind of acceptance that they are better than me in particular field, respect for that thing, and we focus more on the point, like rather than the person. So whether I am saying or someone else is saying, you focus on the point, what is best for the patient, what is best for the organization. You focus on that and be as objective as possible. So
Hmm.
if you do that, automatically you command authority. I mean, they respect the authority, and you get that respect. But
Yeah.
you should try not to exert your authority. That
Hmm.
should be the last thing that you should be doing in any meeting or in any conference. I mean,
Perfect. Okay. Is leadership in healthcare more about expertise or trust?
I think it is more about trust
Trust.
because expertise, AI is coming, technology is upgrading. Uh, there are things which are helping you do advanced diagnosis and all. So trust is most important. If I am able to trust someone, trust a doctor or trust a person, that he will not do a wrong job, he will be ethical, he will not compromise with his integrity, his or her integrity. So that is trust is the most important. Expertise, you can train people in a particular task. You can hire someone who can do that task for you to kind of work the way I hire a good marketing head. They can
Yeah.
hire respective person who can kind of uh,
Yeah. Deliver well.
manage their manage their weaknesses. So trust is most important because trust
Got it.
is patient when patient is coming to the doctor, he is trusting that doctor with his
Hmm.
life. There is nothing more than that. It's not a simple thing. Some
Yeah.
patient is going undergoing heart surgery. He is allowing that doctor to cut his chest.
Yeah.
I
Yeah.
mean, that's the level of trust that patient has in you.
Hmm.
So trust is most important. Expertise is definitely given.
All right. Okay. Tell us, for someone in medicine today, what separates those who lead from those who follow? What are the traits if somebody has to learn?
So again, as I said, clinical excellence and patient satisfaction. So these two things are very important. So in our strategy class, we were taught that there are three things that you help you lead: product supremacy, operational excellence, and customer intimacy. So I think clinical excellence and patient satisfaction, customer intimacy, and operational excellence. So both things are very important.
All right, perfect. Now, once that identity settles, you stop reacting to the present and start building for the future. What is the biggest shift coming in healthcare in the next 10 years? Because what you're building today is shaping what's coming next. So, what your answer to that?
So next 10 years are kind of transformational.
Okay.
1947, our healthcare market was around $1 billion.
Mm-hmm.
2024, it is around $400 billion. In 2030, it will become $1 trillion.
Oh,
So
wow.
77 years, we reach from 1 CR to 400 CR. In
Hmm.
6 years, we are reaching from 400 CR to 1000 CR, almost 2.5 times. So whatever growth we achieved in 77 years, 2.5 times that growth we will achieve in next 6 years. And
Wow.
in next 10 years, like in 2035, market is expected to become $1.6 trillion. So that will be four times our current market. So whatever we achieved in 77 years, next 10 years, we will achieve four times of that growth. So that's the kind of opportunity this market has, and next 10 years will be transformational.
Mm.
AI will come, it will reduce the gap between doctors' understanding and patients' understanding.
Hmm.
Government is working very hard. A lot of medical students are getting added, so MBBS seats are added,
Yeah.
post-graduation seats are added. So supply side will be taken care of. A lot of private equity is coming. So a lot of
Hmm.
new hospitals will come in India. So it's huge and it's transformational and very exciting.
Talking about AI and the expansive role in healthcare that we can see in the future, do you think will technology redefine patient care or just optimize it?
I think it will optimize it because nurses who care. Then doctors who use their intuition in emergencies, what treatment to be given, the call that they have to take. So all these things cannot be replaced. I mean, empathy cannot be replaced. The doctor's touch cannot be replaced. Nursing care cannot be replaced. So these are, it's more human kind of thing, healthcare. It's not a kind of a product thing. So since it's human beings are involved, it is more of human care. So technology will be kind of, it will
Optimizing.
help you take better decisions, but it cannot replace it. I mean, it will support it.
Okay. All right. In your opinion, where is the system currently broken? Where do you see a potential still?
Okay. So as a country, I feel that uh, this tertiary care and like in healthcare, there are primary preventive healthcare, primary healthcare, secondary healthcare, tertiary healthcare, and quaternary health.
Hmm.
So tertiary healthcare and quaternary healthcare is not available in tier 2 and tier 3 cities.
Hmm.
So patients travel from tier 2 cities, tier 3 cities to tier 1 cities. So that is happening currently. So this availability and accessibility, the way I said, the scale. So that treatment is not altogether available in tier 2 cities and tier 3 cities. So that is the most broken part. Second is even in tier 1 cities, not everyone can afford tertiary care and quaternary care because it is costly. You have to hire so many doctors, infrastructure, everything. So it is costly and insurance penetration is not very high. So even in tier 1 cities, patients are not able to afford tertiary and quaternary care. But this scene is changing. Government has started the Ayushman Bharat Yojana, which is covering around 50 CR poor people. So they are insured. Corporate companies are giving insurance coverage to all their employees. Our insurance awareness is increasing. So in next 10 years, things will drastically improve, and hospitals will go in tier 2 cities, tier 3 cities, and this problem that we currently have will get sorted out.
All right, perfect. Now, in your opinion, what does a world class hospital of the future look like?
Okay. So as I said, it will cover all aspects:
Yeah.
preventive healthcare, primary healthcare, secondary healthcare, tertiary healthcare, and quaternary healthcare. It will move from sickness to wellness or illness to
Hmm.
wellness. So what is happening right now is that like when child is born, till I think 5 to 7 years, till the vaccinations are going on, they visit hospital, and
Hmm.
after that they only visit on need basis. Only
Hmm.
if you are sick or there is something, some untoward thing happens to you, only then you visit the hospital. So
Hmm.
future hospital will not be like that. Future hospital will be a part of your life journey. It will help you, it will guide you. So preventive health checkups will have a huge role, and these hospitals will be part of your life, not
Got.
only like a destination to go when you are in trouble.
All right, perfect. Tell us, are we building for scale or quality? Where is the focus?
Right now, it is scale because it's not available at all in tier 2 and tier 3 cities. So reaching there is most important. Starting hospitals in tier 2 cities, tier 3 cities, that is most important. So scale is first thing that we need to do. And then quality we definitely have to improve because it is given. Without that, you can't deliver healthcare. But
All
right
right.
now, India needs scale.
Okay. I'm going to take you to our next segment where we want speed because it's the rapid fire. So, anything and everything that comes to you instinctively, let me know. Are you ready? All
Driven
right. Data or instinct?
instinct,
Delay or decide fast?
delay.
Okay.
I
One.
generally like any tough call. I generally take 24 hours before I take a call because emotions subside and then logic prevails, and then after 24 hours you can take a rational decision.
Perfect. One leadership trait you had to unlearn.
Hmm. I think urge to leadership, like urge to lead. So
Okay.
when you are managing a team, you lead that team, and
Hmm.
you have that urge to leadership. And in early part of career, it helps. But as you grow, you are not leading teams. Now you are leading leaders.
Yeah.
So in that case, you have to let go that urge to lead. So
Hmm.
that is one thing that I had to leave. That you have to rely on the other person, let him lead or let her lead, and you lead that person instead of leading the team.
Beautiful. All right. One belief about healthcare that changed.
When I was practicing in villages and all, so I used to think that affordability is the most important thing, right?
Hmm.
Because patients were poor, they were not able to afford investigations and all. So when I went to do MBA, my intent was to make healthcare affordable. So that was the intent with which I went. But now I have changed my belief. There are so many people. Affordability is not an issue. People are ready to gather money from here, there, everywhere, and anywhere from anywhere, but they want quality health.
Hmm.
So that that was something like I wrongly pursued about healthcare market, that patients only want affordability, patients want quality. Affordability, they feel that that is our concern. We
They
will
will.
manage it,
All
but
right.
quality you have to deliver. So
Okay. Okay. Biggest myth about hospital leadership.
generally, they feel that everyone feels that they only care for star consultants
Hmm.
because they are the revenue drivers or they are the main component of the hospital. That is not entirely true. We focus on all employees, all doctors, all patients. Everyone is important. It's not the case that only star consultants are important.
Got it. What are you building internally right now?
Internally, myself,
Yes.
I am trying to be present, be mindful. So that is something that I am learning to do because so many things happen at so many places, and you're not able to do justice to what is right now present with you. You are either worried about the future or you are worried about the past. So focusing entirely on present, this is something which I am trying to learn.
Okay, amazing. We've come towards the end of the segment. Now, this show is called Unapologetic Me for a reason. So, let me just ask you, Dr. Samir, what are you the most unapologetic about at this phase of your life?
Being very emotional.
Okay, that's a good answer. Do you want to elaborate?
No, no. I mean, I'm very emotional, so I take decisions basis emotion, and a
Yeah.
lot of decisions are driven by emotion.
Hmm.
So uh, initially, I used to feel that it is a weakness, but
Hmm.
over the period of time, if I am able to achieve results, practically I am able to achieve results. I am successful, and emotionally, I am doing good work. I am happy about it. I am making other people happy. So there is nothing wrong in being emotional. It's
Okay.
fine.
Thank you so much, Dr. Sameer. What stood out today wasn't just scale, it was clarity. The ability to operate in complexity without losing sight of responsibility, to make decisions where outcomes aren't just numbers, they are human, to lead systems that don't just function but serve. Because healthcare isn't just an industry, it's a responsibility. And leadership here isn't about authority, it's about accountability. This is Unapologetic Me, and here we don't just talk about building, we talk about what it takes to carry it. I'm your host, Ekta Kurana. I'll see you in the next episode. Until then, live your life unapologetically. Thank you.